I'm Natalie Shurtleff. I'm the Associate State Director of Advocacy and Outreach with AARP Connecticut. Welcome to another episode of Coffee and Tea with AARP Connecticut, a bi-weekly interview series on the issues important to people 50 plus in Connecticut and their families. Today, AARP volunteer Lottie Prushinski and I welcome Maureen McIntyre from the North Central Area Agency on Aging. Before we get into our questions with Maureen, I'd like to give Lottie a chance to say a few words about herself and her role as an AARP Connecticut volunteer.
Thanks, Natalie. I started volunteering with AARP about 12 years ago, teaching AARP driver safety courses, and another driver safety volunteer was telling me about other opportunities with AARP. So I started doing other volunteering with AARP, including advocacy, and that's mostly meeting with our state representatives, talking with them about the challenges facing us as we age in Connecticut, and addressing issues that are important to the 50 plus population, including knowing and understanding Medicare and Medicaid. And volunteering has been very rewarding for me. I've learned a lot and I've made a lot of new friends. So thanks, Natalie, for inviting me.
Well, thanks for all you do, Lottie. Maureen, welcome back. I know you've joined us previously to talk about the area agencies on aging. Before we dive into today's topic of Medicare and Medicaid, would you remind us a little bit about yourself and about what you do at the North Central Area Agency on Aging?
Sure. Thank you so much, Natalie. Lottie, it's great to see you, and thank you so much for having me back. I really enjoy our conversations. My name is Maureen McIntyre. I am the CEO of the North Central Area Agency on Aging. We are one of 5 area agencies on aging in the state of Connecticut, and together our association is called Aging CT, which we're very proud of our recent rebranding. We are each individual private nonprofit organizations with a goal and purpose of maintaining older adults and people with disabilities in their homes and in their communities for as long as they'd like to be there. We have a lot of different areas of specialty, and obviously talking about Medicare and Medicaid happens to be one of them.
Thanks, Maureen. Now let's shift to talk about Medicare and Medicaid. First, I know many people get the two programs mixed up. Can you tell us what differentiates Medicare and Medicaid?
Sure, and that is a great place to start. And I am actually going to start with one reason why they are similar, and that's because they come from the very same place. They are both pieces of the Social Security Act. One, Medicare, was Title 18 of the Social Security Act, and Medicaid was Title 19 of the Social Security Act. So many of your viewers and listeners may have known about Medicaid and Title 19, but now they know that it's the very same thing. So I figured that would be a good little factoid to lead with. But now, how they're different. Essentially, it comes down to a couple different things: locus of control and eligibility, right? On the one hand, we have Medicare, administered at the federal government. It is something that all of us, once we should be lucky enough to reach the age of 65, will be entitled to. Medicare also covers people with disabilities who qualify, and also people with end-stage renal disease. Medicaid, however, is kind of a co-branded opportunity between the federal government and the state of Connecticut. And that comes with a fairly robust set of eligibility requirements, income most notably. So between the two of them, the locus of control, federal level for Medicare, state level for Medicaid, and eligibility, pretty much available to all of us once we reach 65 or fall into those classes that I mentioned, or have to qualify based on economic factors and other things.
Thank you. So sometimes we hear the term dual eligible. Can you tell us more about what it means to be dually eligible?
Sure, and kind of as it sounds, people that are considered dually eligible are enrolled in both Medicare and Medicaid, but only by virtue of the fact that they qualify for a special type of a program called a Medicare savings program or a buy-in program. These are all terms of art, which I don't want your viewers and listeners to go too crazy for, because this goes down rabbit holes really fast.
Yep.
But the bottom line is, for people that are dually eligible, there is a special set of circumstances that they qualify for this particular coverage, so that they don't have to meet the very stringent guidelines of a full Medicaid eligible person. Okay, that is the most important thing to know about being dually eligible. And I think, as we continue our conversation, we'll talk a little bit more about those buy-in programs when we get into, what the various programs cover and frankly, what they don't.
Maureen, I think our audience could benefit from understanding more about what is covered by Medicare and what is not covered. Can you tell us what each Medicare part covers?
Absolutely. And I used to joke when I was a younger person working in this field that I would retire before we got to Medicare Part Z. So I'm glad to know that we're actually only through Medicare Part D. So that's a good thing. So I'll give you a very brief overview of all of these. Medicare Part A is your hospital coverage. Everything that takes place within those hospital walls, that is the purview of Medicare Part A. In brief, Part B is your doctor's services, things that are taking place not within the hospital, but are taking place in your doctor's offices, in your clinics. That is where you will find coverage for outpatient services. That's where you'll find coverage for your home health services, things of that kind. Items and services not covered under a hospital benefit. Part C is also called the Medicare Plus Choice, or the Managed Medicare, or Medicare HMOs, quite a smorgasbord of names. The bottom line with Medicare Part C is it's another way to access your Medicare benefits. So, for example, Medicare C plans or Medicare Advantage plans have to cover everything that traditional Medicare covers, but they have flexibility and also may have some opportunities to add additional benefits. So think of Medicare Part C as everything that you were receiving in A and B together, but packaged a little differently and managed through insurance companies as opposed to the federal government. And then our last but not least is Medicare Part D. This is the most recent on the scene. Many of your listeners and viewers are probably aware of Part D as the pharmacy benefit. This is the part of Medicare that pays for medications. And kind of going back to our Part C communication that we just had, with the Part A and the Part B, you are likely to purchase Part D also. But in many cases, there are Part C plans, Medicare Plus Choice, Medicare Advantage plans, that also include Part D. So if this is as clear as mud, you are not alone. There is a lot to understand. There's a lot going on. And one of the greatest resources that I will refer to at this point is the Medicare and You Handbook that goes through each of these in a lot more detail than we have time for today.
Well, thank you for that overview. Can you tell us, is there anything different about what Medicaid covers?
Medicaid, again, we're kind of talking about that locus of control. Medicaid is going to cover just about everything that I just talked about with Medicare. However, it's all administered within the state of Connecticut. So, for example, the state of Connecticut can and will set eligibility requirements. The state has the opportunity to petition the federal government to add benefits, to create packages of benefits for different types of consumers. But in general, just like with Medicare, there are very specific things that are mandatory benefits. It has to cover physicians, it has to cover inpatient and outpatient services, x-rays, nursing homes, which I think I'll go back to in a couple of minutes now that it's occurring to me, and also medication assistant treatment. So, there are those very prescribed benefits that all state Medicaid programs have to have, but then the states are also given a lot of latitude in terms of what they can add and how they can package and what they can do and who they can serve.
Maureen, it's understandable that these programs can be confusing for consumers. Can you talk a little bit about resources? For example, the Choices program.
I'm so glad that we got to mention choices in this capacity because, as you can see, there is a lot here. And what I've just briefly gone through with you is actually a 6-day training that our choices counselors go through to learn and become expert in this. So again, if you're listening to me going, I have no idea what it is she just said, that's okay, because there are a lot of us experts out there whose job it is to understand. And so our choices programs around the state are really good for this, as is that Medicare and You handbook. So I would highly recommend that. But one of the things that, in my opinion, is very important to choices in particular is when we start to talk about, again, how difficult this is, there are also lots of procedural items and things that are very specific deadlines, things that you have to do by certain periods of time. And so a lot of the programs that we offer include educating beneficiaries about all of this stuff. I mean, there's new to Medicare boot camp, how to learn about all of these things before you actually need them. So we like to think that education is the very best medicine and education is the best policy, whatever analogy, whatever platitude you want to use. Knowledge up front is absolutely a wonderful thing. And we're very happy to offer that through the Choices program.
Thank you, Maureen. That was very helpful. Now, is there anything we have not covered that you'd like to share with us today?
Yes, thank you for asking, because at the end of the presentation, there are always a handful of things. And one of the important things that I wanted to mention with respect to Medicare in particular is not just what it covers, but what it doesn't cover. I think that there is a very substantial, and I believe it remains today, there is a misunderstanding about the role of Medicare in long-term care, in care in general. Medicare was never intended to be the end-all be-all of health insurance coverage for older adults and people with disabilities. It was never intended to be all inclusive. And it's one of those pieces of, if I leave you with anything today, one of those would be, please check in your wallet, please check in your pocketbook and see what your coverage looks like. If you only have a Medicare Part A and B, please reach out, because as with many things, you can purchase additional coverage. But if you just have Medicare, you're leaving yourself open to substantial copays and coinsurances and things of that kind, and deductibles. And that brings us back, see what I did there, to our dually eligible conversation. Dually eligible folks have those deductibles and those coinsurances and those copayments covered by virtue of the different programs that they may be eligible for under that dually eligible umbrella. So it's very important, again, to check your coverage, because depending on your situation, you may be eligible for programs that will fill all of those gaps. And as a matter of fact, one of our service navigators from our program just the other day was telling me about a consumer that she worked with who was paying for a very expensive health insurance plan. And it turned out that he was eligible for one of the Medicare savings programs and wound up saving, I believe it was close to $200 a month just on health insurance that he no longer had to pay for because he qualified for another program. So please, please, please check your coverage. And even if you are covered, check it on an annual basis. Make sure nothing has changed. So that is definitely something that I wanted to mention on my way out. The other things that I wanted to mention, just very briefly, if you don't mind, one of which AARP is really, really good about is continuing to beat the drum about scams. We are seeing a substantial uptick in scams against older adults. And from my perspective, again, knowing that AARP does such robust work in this space, I want to mention just the opportunity for people to please take and read your Medicare statements and your Medicaid statements, making sure that the things that are listed are actually services that were provided to you. Please help us monitor that kind of activity, because when the Medicare system is compromised, it compromises all of us. Because as you remember, we're all paying into that and we're all eligible for it at our in our older years. So help us keep track of the spending of the Medicare program by making sure everything is legitimate. And then finally, remembering this too, as with all of the different state and federal programs, if you feel as though your coverage has been denied, or if you're just not sure about something that you've received, please reach out. Medicare in particular is one of those areas that is fraught with, a little bit of unknown. When will my coverage end? How can I be sure that was appropriate? Most of these decisions are being made when we are not at our best, right? Coverage decisions mean that we are receiving care and all of a sudden we're not. And what does that mean for my family? And what do I do now? You never want to be in a position where you're making these decisions under duress. So just know that between the area agencies on aging and in Connecticut, we are so fortunate to have the Center for Medicare Advocacy. There are experts who make it their job and make it their life's work to make sure that Connecticut residents have access to the services they need and have the opportunity to appeal any decisions that we just don't feel comfortable with. All right. So here in Connecticut, we are lucky, but only if we know where to go and look. So I think that's everything that I wanted to relay today. I know that's a lot. And again, I would highly recommend anyone with questions to give the area agencies on aging a call, because this is what we do. And we know that sometimes reaching out is the hardest part.
Thank you so much. And thank you, Lottie, as well. Thanks to all of you, our viewers, for tuning in for another episode of Coffee and Tea with AARP. Join us again in 2 weeks for another episode, and catch back episodes on demand right here on our Facebook page and on our YouTube page. So scan this QR code to become an e-advocate and help us advance policies important to the 50+ here in Connecticut. Thank you.